Well, it's something we report on all too often. Young lives cut short in an instant. Teens and children killed by gunfire.
Lisa Evers talks to the doctors on the front lines and a mother coping with the senseless loss of life.
It's not like time heals. As years go on, as you acquire more, as you do more, it's always that one person missing. And you always feel that missing part.
It's been 15 years since Odessa Napper-Williams lost her son Andrell to gun violence. 15 years coping with an unimaginable loss.
It has been my strength to keep his name alive, to keep his legacy alive, to just keep the world remembering him. Everything I do is in remembrance of him.
Sadly, it's a pain even more parents have endured in recent years. Numbers from the NYPD are alarming. In 2017, there were 75 shooting victims under the age of 18. By 2022, that number doubled to 153. Makeshift memorials have become an all too familiar sight. The fear is real.
I pray for these kids every day that when these children walk out their door, to God to protect them.
It's not just New York City. Across the U.S., firearms have now surpassed motor vehicles as the leading cause of death among kids and teens, according to researchers at the University of Michigan. Pediatricians here in the city are seeing the harsh reality firsthand.
Since the beginning of the COVID pandemic, we have seen about 185% increase in the number of gunshot wound patients that we are treating here at Jacobi.
Dr. Noe Romo is the director of pediatric inpatient service at Jacobi Medical Center.
A couple of years ago, we did a study in our emergency room just surveying children that came into our emergency room ages 11 to 17. And what we found was that close to 50% of those respondents reported knowing somebody who was killed in the past year. Close to 60% reported hearing gunshots nearby in the last month. So the impact that has, right, on a developing brain and on a child is significant, and it's something we don't talk about enough.
Dr. Romo believes the problem needs to be addressed as a public health crisis. At Jacobi, he serves as medical director of the Stand Up to Violence program.
Here at Jacobi, we've been able to establish the Stand Up to Violence program, which is a hospital-based violence intervention program, which encompasses a team of social workers, physicians, and community outreach workers to really respond to patients who are victimized by violent trauma.
As a pediatrician, all of us are tasked with trying to keep kids healthy and safe.
At Montefiore, Dr. Alyssa Silver is an associate professor of pediatrics at the Children's Hospital. While it isn't a trauma center like Jacobi, she's also seeing the impact there.
We've actually had several parents tell us, when we're talking about nutrition and exercise, that parents are afraid to let their kids go out and play because of the rise in gun violence in certain neighborhoods.
Dr. Silver's focus is on prevention and advocating for safe firearms storage.
It kind of naturally flows with the counseling that pediatricians give when we talk about the other safety issues like car seats and bike helmets. This is just one other thing. So you have your guns stored securely. That's it. No judgment, just kind of these are the things that we need to do to keep your kids safe.
Both doctors agree much more needs to be done.
I feel like it's something that we know that there hasn't been a lot of resources devoted to trying to prevent firearm-related injuries, and especially the fact that it's now the #1 cause of death in kids.
I think as a city, we can do a lot more in terms of expanding these types of programs to be present in all of the trauma centers in our city.
It's a sentiment shared by Odessa Napper-Williams, who now devotes her time helping other families navigate the emotional trauma after losing a child to gun violence.
Supporting, hand-holding, coddling mothers, just being the spirit of presence amongst them, sending them balloons when it's a transition day, flowers on their birthday.
But Mrs. Napper-Williams recognizes that especially for mothers, it's a wound that never truly heals. Lisa Evers, Fox 5 News.